and we'll kick her off.
There you go.
Awesome, thank you. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Tasha Sizemore, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2023 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During the hearing, carriers will provide information on their plans, including network and benefit changes, and are permitted to defend their rate assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. So when we are reviewing a rate request, the Division actuaries consider factors including recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, and that's how much of every dollar goes to pay healthcare and claims costs to ensure that the requested rate is not projected to trigger federal rebates or payments from other federal programs. We also look at the history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, and the administrative costs. Division staff also ensures that the rate filing meets all the requirements of the Affordable Care Act and determines whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate requests for all of these companies on our website, www.oregonhealthrates.org, and all communication for all of the health insurance rate change filings, including written answers to all questions asked during the review period, are posted there as well. In this hearing, we are discussing, in this order, the preliminary rate decisions that the Division has made on individual and small group health benefit plans filed by Moda Health Plan, Inc. and Pacific Source Health Plans. Our agenda for this afternoon will be representatives from each company will make a presentation and describe their rate requests. The Division staff will lead a discussion about the Division's preliminary decision on each filing and the preliminary rate decisions. Finally, we will accept public testimony. If you would like to make a comment on a company's filing, please unmute yourself. Please unmute and introduce yourself and make a comment. Comments will also be accepted online through 11:59 p.m. on July 28th. The Division will make a final decision about these rate filings shortly after the public comment period ends on the 28th. Moda, please begin by introducing yourself and sharing your slideshow presentation and explaining your rate request.
All right, thank you. My name is Alex Vanos, and I'm the actuary here at Moda that's responsible for our ECA rate filings. So I'll be giving our presentation for both individual and small group today. Let's see. Is my slideshow up?
Yes.
Okay. So yeah, like I said, here to talk about our 2023 rates for Oregon individual and small group. So starting off with the individual filing. As of June 22, 21,595 subscribers are impacted by our rate filing, 30,382 members. And then you can see in the table below, our overall average rate increase that we requested is 5.8%. The minimum and maximum range goes from a 1.5% increase or decrease up to a 13.6% increase. And in this filing, we did make some modifications to both our area factors and our network factors. So the rate increases by plan vary by those two considerations. Looking at the plan modifications, all plans that did not have any changes are not shown here. So I just have a table of plans that did have benefit changes. So every year, the AV calculator comes out and we have to make sure we stay within the AV ranges for specific metals. So you can see not a ton of real significant changes here. There were some adjustments to the out-of-pocket maximums to meet those updated AV requirements. One of the things we identified was our primary care office visit copay for bronze. We did kind of a market check on there. We were a little high, so you can see those all came down $10. So we're able to actually richen some of those bronze benefits. And then there were a few other plans where there was some, 5% coinsurance changes. And again, the kind of trigger for all this was just making sure that our plans met the AV ranges for 2023. For 23, we did not have any discontinued plans. And then we offered both on our Beacon network and our Affinity network, higher deductible silver plan, the deductible on those plans being $6,400. For our HSA plans, there was no changes made there, no changes needed to stay within those AV thresholds. And then network changes, no changes for 23. So consistent with prior years, Moda offers plans on 2 networks. So we have 17 plans that are offered on the Beacon network, and I've got a little map of Oregon in that upper right. So Beacon is all the Moda plum color. So that's available in 13 counties. So Beacon is the only offering in areas 1 and 5. And then it covers parts of areas 6 and 7, where we also have the Affinity network in some counties within those regions as well. Of those 17 plans, we have 4 gold plans, 9 silver plans, and 4 bronze plans. And then one of the reasons there's more silver plans offered is 4 of those are off-exchange offerings only, which were newly made available in 22. So that's one of the reasons we've got roughly double the silver plans as the other middle levels. The Affinity network is that blue, teal, green color in the upper right. It's available in 19 counties. It's the only offering in rating areas 2, 3, and 4. And then, as I mentioned earlier, parts of 6 and 7 are covered by the Affinity network as well. Kind of similar structure to Beacon. So of those 14 plans that are offered, 3 gold, 7 silver, and 4 bronze plans. 3 of those silver plans are off-exchange only plans. Okay, moving on to small group. So as of June 22, we've got 3,809 subscribers impacted by our rate filing, 5,969 members. And then looking at the table below, our overall average increase for 23 was 3.6%. That ranges anywhere from a 5.2% decrease up to a 10.4% increase. And that's due to one of the changes we made was to update our area factors for 23. Small group, we offer a greater number of plans, and that was kind of part of the reason for we've got a bit more plan modifications here. I'm not going to talk through every single change, but one of the things we saw was our gold plans in particular were having a hard time. They were falling outside the updated AV thresholds when we ran it through the 2023 AV calculator. So those we're looking at greater out-of-pocket max increases, and we did that so we could hold a lot of the other first dollar benefits the same or similar. So that's kind of the major change for small group. So you can see there were some other plans with some smaller modifications. And we've got both the Connexus and Moda Select plans on here. And then since we were looking at a lot of plans that were outside the AV threshold when we ran it through the 23 calculator, instead of significantly disrupting a lot of plans, we chose to discontinue the ones that were more challenging and offer similar but a few more new plans. And so you can see a lot of these, like, if you take the Silver 3000 plan, for example, we discontinued that, but we're offering a very similar Silver 3500 plan for 23. So that was kind of our approach to make sure we're meeting those AV thresholds and modify the benefits. In terms of the HSA plans, for renewing plans, no changes were made. For 23, we did expand our HSA plan offerings. So we did discontinue 2, but then we have 6 new plans being offered. So we increased the number of HSA plans that we're offering by 4 for 2023. Network changes, no network changes for 23. Consistent with 22, we have 2 networks for small group as well. So we are offering 21 plans on the Connexus network. That one's available statewide. All counties are covered. We have 2 platinum plans, 7 gold, 8 silver, and 4 bronze plans. And then the Moda Select network, which we implemented for 22, we have 12 plans on that network, and that's going to be just available to employees living in the Multnomah, Washington, and Clackamas counties. It's got a very Portland metro specific service area. And on that network, we have 1 platinum, 4 gold, 5 silver, and 2 plans. 2 bronze plans is the plans offered on Moda Select. And that's it for Moda. So I'll stop sharing here and turn it back over to you guys.
Thank you. Okay. Division staff will now lead a discussion about the division's review of the filings and the preliminary decisions. Before they do that, though, would you like to do introductions, Michael?
Yes, my name is Michael Sink, Senior Life and Health Actuary for the division and primary reviewer for this filing.
My name is Ying Liu. I'm an actuary for the division, and I'm the secondary reviewer for this filing.
Okay, let's get started then. So the division reviews on an annual basis these individual and small group ACA filings, and there are 3 primary buckets that all review goes through. The first thing we look at is we look at the data that goes into the filing. That is the members, the experience, any of the other data-driven factors that is the starting point for this filing, and that is for the 2023 rate filings, that would be the calendar year 2021 data. For the most part, they would use additional information on what changes have been made to rate filings approved for last year, and also membership information available in 2022. For individual, Moda has 30,000 members approximately. That is more than enough to be credible. We take a look at that as well. There's no reason to believe that given the information we have been given from the company, that there would be significant changes based on data-driven assumptions, membership changes, things like that. The second bucket we look at is the assumptions bucket, and this is everything they use, the calculation and estimates to get from the base period, which is 2021, to the filing period, which is 2023. And that includes various factors of various significance in the filing. The primary driver for the 2023 rate filings is the medical inflation or the trend. And I'm going to talk a little bit about how this plays out with the cost growth target initiative after I get done with the review of the individual and small group filings. This will cover not just the Moda filing, but pretty much all filings for this year. So take a look at that if you're interested, but I'll keep on going with this filing. So there were several assumptions that we looked at for 2023 that are not significant drivers of the rate increases this year. They're varying significance for other carriers, other rate filings, but these were not major players in the Moda filing. The first one is risk adjustment. This is not only the assumptions of what the mortality, the morbidity is for the company in 2023, but also the data that was given, the initial estimates that were given in for 2021, as well as the restated values from what they know mid-filing. There have been some new data come in since the original filing on what the risk adjustment was for 2021, and that is compared to what they estimate for 2023. Not a significant change for this year. Reinsurance. We take a look at the reinsurance factors that go into these filings, both on the aggregate level to look at the budgeted amounts for reinsurance for the individual program, as well as what each individual company had. This is not a significant change to prior filings. The silver loading, this is where we have the cost sharing reduction non-payments have been loaded into the silver plans that are on exchange. That's why they have these off exchange plans for individual. And there's a silver loading that goes into those on exchange plans. That has not changed significantly from the prior year. COVID is not a significant player for the 2023. That's baked into the experience for 2021 and is part of the calculations going forward into 2023. And another one, this is an interesting one that was could have possibly been an issue this year. We were watching for it, but inflation. And this is the non-medical inflation. You've heard in the news that non-medical inflation does not seem to have played a significant factor in the medical inflation for 2023. That the medical trends that have come through for this year are not significantly different than last year and the year before that. They've been fairly flat. Now, does that mean that it's never going to affect? We can't say that at this point, but it is important to note that there is at least talk that this could be a concern in future years. But right now, that is not a major driver. The item that is the major driver for most companies is that medical trend. And the medical trend for Moda Health Plan for their individual filing is 6.6% overall, and that's the allowed number, which includes a cost trend of 4.9% and a utilization trend of 1.6%. On the small group side, while I'm here, slightly lower, 5.3% overall. That's a 4.2% cost trend and a 1.1% utilization trend. I'll talk a little bit more about that in the cost growth targets in just a moment. And that is the second bucket. That is the assumptions bucket. We take a look at all of these assumptions. We decide whether or not the assumptions are reasonable and appropriate, but that they are used correctly. And finally, the last bucket is the calculations. The calculations is how you get from point A to point B. So in this case, how they apply the trend, how they apply these assumptions to the data from the first thing we review to get to the final requested rate increase. And for Moda, the final number is 5.8%. The calculations we deemed were accurate and correct, and used appropriately. So that gets us down to this rate filing. For the individual rate filing, they're asking for a rate increase of 5.8%, which is almost identical to their medical trend for 1 year of 6.6%. As I said, this is a very straightforward filing. We found no concerns with this filing at this time, and we are going forward to approve this filing as filed. On the small group side, they are requesting a 3.6% rate increase, and that is compared to their 5.3% allowed trend. So they are asking for less than actual trend. So they're actually doing a little better than expected. If nothing changed from year to year, you would expect everything to go up by that trend amount. And so again, for small group, we are recommending approved as filed. That gets me to the next point I'd like to talk about, which is the Cost Growth Target Initiative. And this is a joint effort by OHA and DCBS to monitor the cost growth, and this is across all medical products. This is including your Medicare and Medicaid. It includes your commercial products that we do review the rates for, which is small group and individual. It also includes those that we do not review the rates for, which is large group and miscellaneous self-funded groups. So you take those all together, and the goal of the program is to keep cost growth down to the current target, which is 3.4%. And so that is the goal. Since OHA and DCBS have different roles in this initiative, me talking about DCBS's role and the current progress in that initiative is not going to be the entire story of what is going on with Growth Target Initiative. So as I mentioned, we review the individual and small group cost trends during these rate filings. And these cost trends are based on known contract changes. So they've already taken place for the most part. They know that their doctors are requesting increases, and they've approved increases to this point. But these contract changes have not taken place yet. They are anticipated prospective changes for 2023. So that's a little different than you will hear from OHA, who will then go back and check what actually happened later. But I'm not going to speak on behalf of OHA at this time. But we are only looking at the projections going forward. There are multiple parts of this cost trend. And that's why I brought up on the Moda filing the cost and utilization components. See, we're targeting a 3.4% cost trend, and Moda is coming in with a 4.9% on the cost side for individual, and a 4.2 on the small group side. So keeping that in mind, this still doesn't include, going back to the review of the Moda thing, this does not include this possible impact going in the future on inflation. Inflation is currently running 9.1%. Medical inflation is coming in much lower than that. This does not include that. So by the time we get to 2023, there could be additional pieces, which is why the retrospective analysis is going to come in handy, as well as the prospective analysis. The commercial medical products are typically seen by doctors as a mean to recover the revenue they're required to run their business that they did not get through the Medicare and Medicaid products. So we've seen reports of this in the news. This is being reported to the public that there is a tool that the doctors use to make themselves whole, and that tool is the commercial products. So you would see additional costs feed through on the commercial side that you would not typically see on the Medicare or Medicaid, which have a lot more cost control measures from those institutions that run those programs. And sadly, I have to clarify, DCBS does not actually have the authority to review those contracts at this time. That may change in the future, but as of today, those contracts are not reviewed by us. And there's also other commercial products out there. There's the self-funded groups, there's the large group funded groups that don't even come by our desk. So there are several small group rate filings that we would not even see, or rate increases that we would not even see. So there's also other components besides cost that go into these rate increases. That's something to consider. If you look at the filings, you'll see that we've had a discussion with the carriers, what they think about these other components, and I'll list a few of those comments, or a list of a few of those components right now. For example, in the pricing trend, the primary driver of costs in 2023, there is a cost component, which is the amount the contracts go up. That can be seen clearly as cost, as a cost trend. There's also a utilization component. That utilization component is how much people are using the hospital services or using their doctor services. Is that a cost component, or is, do we have to ration utilization to reach cost goes targets? These are questions that are not answered at this time. So what we would not typically think of as a cost component is affecting the premium rates without, so it is affecting the cost to the consumer, but it's not necessarily something that would be associated with cost. The other things that go through this is the benefits change from year to year. Companies could change the cost sharing on a plan that would have a direct impact on the rates. That doesn't change the cost, that changes the member responsibility, and that has a impact on premiums as well. And the last one I want to talk about, the major one, is the performance of this product. So these companies make predictions on what the rates will be for a given year, and based on those predictions, they will either have a positive margin or they'll lose money on these products. And when they are losing money on a product, they have an obligation to their members to stay in business. And DCBS still has an obligation to monitor that financial performance. So we are still looking at this as the companies have to remain in business, have to remain operational for the duration of their contracts with the members. So we take a look at all of that. What does that mean in the end? Right now, we are just in gathering the data. We do not have any actions for 2023. We have made observations that some costs are exceeding 3.4%. We've made some observations that there are additional costs that are coming up that may not be represented in these filings. We've made observations that there are elements of these filings that are not necessarily cost related, and others cost related ones, for example, our obligation to monitor the financial results, which counter the idea that we need to keep cost growth down to a 3.4%. So that's where we're at today. Just a overall summary of the conversation that has been happening up until this point. And that's my deal. It's a little long-winded. I apologize for that. Thank you.
Thank you, Michael. Moda, do you have any additional information or comments that you would like to make on your filings?
We do not.
We will now take public testimony. I don't believe anybody has signed up to testify. However, if you would like to, please unmute and introduce yourself. Okay. As a reminder, to anyone listening, July 28th is the last day for public comments. Comments can be submitted through our website, OregonHealthRates.org. Next, we will hear from Pacific Source. We will pause briefly. Okay, Steve, we're gonna pause briefly.